W. Oakes.
I am David W. Oakes.
And I love you if you're quadriplegic, tetraplegic like me.
And I love you if you're a quadriplegic, tetraplegic like me.
If you're a psychiatric survivor like me.
If you are a psychiatric survivor like me.
Or if you're not any of those.
Or if you're not any of those.
My friend, the late Justin Dart Jr.
My friend, the late Justin Dart Jr.
was a leader in disability.
Was a leader in disability.
And he connected mental health and physical disability.
And he connected mental health and physical disability.
He said over and over and over.
He said over and over and over.
No forced treatment ever.
No forced treatment ever.
No forced treatment ever.
No forced treatment ever.
And now I think he would add.
And now I think he would add.
Black Lives Matter.
Black Lives Matter.
Black Lives Matter.
Black Lives Matter.
I love you whether you're a relative who's a Democrat.
I love you whether you're a relative who's a Democrat.
And I love my relatives who are Republicans.
And I love my relatives who are Republicans.
Justin worked with both.
Justin worked with both.
And as Joe Biden becomes president.
And as Joe Biden becomes president.
I encourage his administration to look at federal mental health agencies.
I encourage his administration to look at federal mental health agencies.
Look at the National Institute for Mental Health.
Look at the National Institute for Mental Health.
NIMH.
NIMH.
Why don't they look more at alternatives?
Why don't they look more at alternatives?
Like peer support.
Like peer support.
And I especially would encourage Joe Biden's administration.
And I would especially encourage Joe Biden's administration.
And everyone in the U.S. and the world.
And everyone in the U.S. and the world.
To look at the SAMHSA.
To look at the SAMHSA.
I love Ian who's repeating me.
I love Ian who is repeating me.
Tell them what SAMHSA stands for.
Tell them what SAMHSA stands for. That stands for the Substance Abuse and Mental Health Services Administration.
SAMHSA.
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 I've done this work for 44 years.
I've done this work for 44 years.
And for decades, SAMHSA was an ally.
And for decades, SAMHSA was an ally.
They supported empowerment.
They supported empowerment,
recovery, alternatives. But under the wonderful Obama. Who I support. They began funding cities for involuntary outpatient commitment.
They began to fund cities for involuntary outpatient commitment.
This is court-ordered outpatient mental health.
This is court-ordered outpatient mental health.
Now, this has been going on quietly all over the U.S.
Now, this has been going on quietly all over the U.S.
For decades.
For
thousands of Americans.
For thousands of Americans.
Your home becomes an institution.
Your home becomes an institution.
You're court-ordered to take usually drugs, powerful drugs.
You're court-ordered to usually take drugs, powerful drugs.
And sadly, SAMHSA began funding several dozen sites,
And sadly, SAMHSA began funding several dozen sites
millions of dollars.
with millions of dollars.
I've tried to get information from them.
I've tried to get information from them.
They refuse.
They refuse.
Please help,
Please help?
because SAMHSA is refusing to disclose.
Because SAMHSA is refusing to disclose.
1 year ago, I filed a Freedom of Information Act request,
1 year ago, I filed a Freedom of Information Act request,
and they still have not told me anything about these programs
and they still have not told me anything about these
in
programs
terms of evaluating them.
in terms of evaluating them.
One fact is that Black people tend to be in these programs more than white.
One fact is that Black people tend to be in these programs more than white.
Right now, I chair the subcommittee for the Oregon legislature
Right now, I chair the subcommittee for the Oregon legislature
for voice and inclusion of Oregonians
for voice and inclusion of Oregonians
with lived mental health experience.
with lived mental health experience.
Of the mental health system.
Experience of the mental health system.
And we are concerned about the way alternatives
And we are concerned about the way alternatives
to police violence,
to police violence,
like
cahoots
here in Eugene, Oregon,
here in Eugene, Oregon,
need to include the peer perspective,
they need to include the peer perspective,
or else they can be a gateway to outpatient commitment.
or else they can be a gateway to outpatient commitment.
Last week, we met with a representative of cahoots,
Last week, we met with a representative of cahoots,
and they are interested in the peer perspective.
and they are interested in the peer perspective.
Cities all over the U.S. and Canada are looking at cahoots as a model.
Cities all over the U.S. and Canada are looking at cahoots as a model.
Our local affiliate of Mind Freedom
Our local affiliate of Mind Freedom
is looking at these issues.
is looking at these issues.
Mind Freedom Oregon.
Mind Freedom Oregon.
Wherever you are in the world,
And wherever you are in the world,
you can create an affiliate of Mind Freedom,
you can create an affiliate of Mind Freedom,
like Mind Freedom Ghana
like Mind Freedom Ghana
or Mind Freedom Ireland.
or Mind Freedom Ireland,
We're doing great work.
who are doing great work.
Or you can use your group's name
Or you can use your group's name
and simply be a sponsor of Mind Freedom
and simply be a sponsor of Mind Freedom
by endorsing principles.
by endorsing the principles.
I congratulate the National Council on Independent Living,
I congratulate the National Council on Independent Living,
their mental health subcommittee
their mental health subcommittee
has adopted Mind Freedom's Shield campaign.
has adopted Mind Freedom's SHIELD campaign.
Nickel plans to reach hundreds of independent living centers.
And Nickel plans to reach hundreds of independent living centers
About this SHIELD program.
about this SHIELD program.
Today, the climate crisis threatens vulnerable people.
Today, the climate crisis threatens vulnerable people.
COVID is related to climate crisis.
COVID is related to climate crisis.
And the way we treat our environment.
And the way we treat our environment.
For us to live 7 generations in the future.
For us to live 7 generations in the future.
We absolutely need revolution.
We absolutely need a revolution.
Sooner the better.
The sooner the better.
But we will have one.
But we will have one.
Please look at SAMHSA.
Please look at SAMHSA.
And lead on.
And lead on.
Thank you.
Thank you.
I love you all.
I love you all.